Okay. Okay. Perfect. So, what inspired you to transition from traditional dental hygiene to myofunctional therapy?
My children. And I think that that's an answer that I guess a lot of us might give, those of us who are parents. Our children always inspire us in some ways, change our lives. And for me, they changed my career. So I am a mother of four. I have four children, one boy, he's the oldest. And then he's been disappointed every time I've gotten pregnant since because he's got three little sisters. And all four of them had a lot of different issues. Now, I like to say that when we as parents are asked, how's everything? How are the kids? We always give the highlight reels. This one's in karate. This one's got a dance recital. Like everything's great. But underneath all of those wonderful pleasantries is the reality. And for me, my household reality was that my son had a lot of attention and focus, behavioral, social, emotional issues that we struggled with for a while. My daughter had, my oldest daughter, I should say, because there's three of them. My oldest daughter had every sleep issue under the sun. You name it, we experienced it. Sleepwalking, falling out of the bed, tossing and turning, night terrors, bedwetting, like everything. 10 years in a row, every single night, we were guaranteed some type of issue. And more often than not, a combination of issues. And then my youngest two daughters had a lot of upper respiratory issues. So whether it was ear infection, throat infection, congestion, like it was always some mix of that. That upper respiratory system seemed for them to not work very well. So all of my children had very common things. Like a lot of people struggle with attention and focus issues with their children, or sleep issues with their children, or upper respiratory issues with their children. And traditional medicine kind of dismissed it away. Oh, they'll grow out of that, or oh, here's some antibiotics. And it just wasn't something that was handled in that arena in a way that I felt truly comfortable about. It actually took a pediatric dentist that I was working for at the time while I was a hygienist who put together the pieces for me that a lot of what they were experiencing, though it was common, none of it was normal. And a lot of it stemmed back to the way they were breathing